Man I've talked to before, and I always enjoy talking to him, is Dr. Vivek Eranki, who's the CEO of Cosmetic Clinics. Vivek, how are you this afternoon?
Good afternoon, Richard. Very well, thanks. Thank you for having me back.
Pleasure. Now, we're going to talk about Botox today.
Yes.
It's sometimes it gets a bit of a bad rap, doesn't it? And it's not justified, is it?
Yeah, you're right. Sometimes it does get a bad rep, and I don't think it's justified. But the reason why is that Botox is essentially a brand, but it's being used more and more as a general term to encompass everything cosmetics. Just the same way people refer to paracetamol colloquially as Panadol, which is a brand name.
Yeah.
If you look at what Botox actually is, it's a medication that belongs to a family of medications called neurotoxins. And what neurotoxins do practically is that they help reduce fine lines and wrinkles. And the way it does that is when we inject it into a muscle, it blocks a chemical called acetylcholine. And what that does is it stops the signal from going from the nerves to the muscles. So when the muscles can't contract, and they don't contract as often, they don't contract as strongly, the appearance of the fine lines and wrinkles in the face fades. And the effect is very, very temporary. So that's what Botox is mainly used for. People refer to pretty much any cosmetic procedure as Botox, which is where we think that the bad rep is coming from.
But it can also be used for so many other things, can't it?
That's right. Outside of cosmetics, I mean, Botox has a huge variety of reasons. So, for example, pediatricians use it for children with cerebral palsy, where they have muscle spasm. We know that ophthalmologists use it for eye disorders, where people have ocular spasm and strabismus. Neurologists, for example, use it in people who have hyperactive bladder. And neurologists also use it for migraines as well. One of the most common indications of Botox that we see, especially in summer, is that it helps with excessive sweating. So what happens is when you inject Botox into an area which sweats a lot, you need the same chemical acetylcholine to signal the sweat glands to produce more sweat. So it stops the sweat glands from producing sweat. So the amount of sweat decreases. So there is a whole variety of uses of Botox that is above and beyond cosmetics.
And it's quite safe to use it, isn't it? And it's one of the big things that people would ask you, wouldn't it?
Botox is one of the most studied drugs out there, and it's got a very good safety profile. I mean, if you look at what the worst case scenario with Botox is, a very rare complication, especially in the world of cosmetics that we see, is a droop. And that's where the eyelid or the area that's injected gets a bit heavier. And that automatically resolves itself within a few days. So it pretty much is self-limiting. So outside of the worst case scenario, the most common issues that people have with Botox is that immediately after treatment, they get a little bit of redness. I mean, that's expected simply because there are fine needles involved.
Yeah, you're injecting. You would have to expect that.
That's exactly right. And occasionally people may get a tiny little bruise. And again, we said that's expected as well. So outside of that, we are yet to come across any serious complications or any serious medical matters linked with Botox.
The choice that so many people would make as they get older, is it better to use Botox or go under the knife?
Yeah, we recommend everyone to exhaust all non-surgical options before they go under the knife. And the reason is, when you go under the knife, it's not as simple as going under the knife and walking away afterwards with the end result. There is a lot of recovery that's involved. So even if you go before the recovery, I mean, there's multiple consultations, then there's the surgery, which involves a risk of anesthesia and the risk of surgery as well. Straight after that, there are scars. They typically take about 2 weeks to recover. Anything surgical, you're realistically looking at 12 months before you see the end result. And with anything non-surgical, the recovery time is anywhere from a few hours to maybe at tops a few days. The non-surgical treatments carry a lot less risk. They're more predictable. So we always recommend patients explore all the non-surgical options.
And, when people come in for Botox and things like brow lifts and wrinkle relaxers, how quick does it work?
Yeah. Some patients say that they can feel the Botox working within 48 hours. And if you look at it pharmacologically, that makes sense. Within 48 hours, it starts acting at a microscopic level. We essentially tell everyone to expect a outcome within about 2 weeks. So within 2 weeks, you should be seeing the peak outcome of the treatment that you receive. Now, Botox itself lasts approximately 3 months. So most patients get it about 3 to 4 times a year.
And is it cost effective to have this done?
Botox has been getting increasingly cost effective with time. So people naturally assume cosmetic treatments, especially Botox, is expensive. So at Cosmetique, Botox treatments typically start from around $40. So they're very affordable.
So is it so come in and get treated? So can you go into the clinic and you go like, this is me now? What can you do for me? And do you get what's a constructive opinion about it?
Our view when it comes to a consultation is there is no perfect aesthetic end result. So everyone is different. So and the idea of a aesthetically pleasing look for everyone is different. So we, rather than starting with this is what we recommend, we always start with what is bothering you. So if something doesn't bother you, you shouldn't be fixing it, because essentially anything cosmetic is purely elective. And if I was to be honest, it is fairly vain as well. So, but if it does bother you, if it does affect your self-esteem, and if you look in the mirror and you say, you know what, I want something done about it, then by all means we'd be able to provide all the treatment options available, and then talk about the safety profile and the most cost-effective way of having it addressed as well.
And age of people coming in, is there a cut-off point where you go, no, Botox is just not going to help you?
Botox will have a varied degree of effect on different people. Now, different age groups get Botox done for different reasons. Now, the younger somebody is, they typically have a very low dose of Botox done in order to reduce the risk of wrinkles forming into the future. As people age and if people have sun-damaged skin, they usually go for a slightly higher dose to minimize those lines and to reduce static wrinkles. Realistically, it really depends on the patient. So if somebody, let's say in their 50s or 60s, come in and they pull out a photograph of them when they were 18 years old and they say, give me a bit of Botox, so I want to look like I'm 18, then we'd basically say that would not be possible.
You say, good luck there, good heavens on there. And, is there, can you make an appointment at the clinic and come in and say what you'd like to achieve, but it's on a no obligation thing just to come along and have a talk to somebody about it? Because it would be, that daunting the first time you come in.
Yeah, we try and make it as approachable as possible. So we don't charge a consultation fee simply because if somebody wants to come in and have a chat and they don't want to feel pressured into having anything done, we are more than happy to do it. At the end of the day, it's all about educating people. So a lot of patients typically book an appointment just to have a chat to somebody experienced, somebody trained as to what the different treatment options are. And if they want to proceed with the treatment, we're happy to do so. If they just want to go home, think about it, that's fine as well. If they just want to come and have a chat, that's fine as well. So, and we make a booking of appointments very approachable as well. So the vast majority of appointments are booked online. So more than 80% of patients typically book appointments online for us.
Which is I'd say probably the best way to go along and do that. For so many people out there, where can we find out more information, Vivek?
Yeah. Cosmetique.au. We have a lot of information about Botox and about wrinkle relaxers. We also carry a lot of before and after images on our website as well as our social media. So that's Instagram, TikTok, and Snapchat at the same address, cosmetique.au, and there's a link for the online booking portal there.
Which is great. Vivek, always enjoy talking to you. Dr. Vivek Eranki, CEO of Cosmetique Cosmetic Clinics. It's cosmetique.au. Have I got it all correct?
That's so much, Richard.
No worries. Thanks very much. Enjoy the rest of your long weekend.
You too.
Thank you.
Bye-bye.
Bye.